What's up everyone? Day 8, no power here in Salem, Oregon. We're thriving, we're surviving. Today we are going to talk about heat versus cold therapy, specifically for snowsport athletes, weekend warriors, when to use it, when not to use it, how long to keep it on, how long to take it off, when is it beneficial, etc., etc. Before we get started, my name is Mark. I'm a doctor of physical therapy. I am one half of Mobility Duo with my wife, Sarah. We work primarily with snowboard athletes or snowsport athletes. We are athletes ourselves, working on prehab, rehab, strengthening, flexibility, mobility, you name it. If you get a chance, please subscribe. It really helps us out. We put a lot of work into these videos. Let's get going. Okay, so let's get started with heat. Primarily, heat you'll find in the form of a heat pad that you just plug into the wall, or a sauna, or a hot tub. You can use a rice pack. Okay, so what are the benefits of heat therapy and when to use it? Generally, heat therapy is going to be used to increase blood flow, so generally for healing processes. It's also going to increase muscle flexibility, and it will increase that blood flow for damaged tissues, as well as if you have tight muscles, specifically like low back pain, if you have tightening of the low back, heat pads can provide a lot of relief. In regards to time, we generally want to put something in between the heat pad, or if you are using a heat pad, just protect the skin. So general times, I usually tell patients 20 to 30 minutes max. I'd want a towel in between that. I'd want to check that after about 10 minutes. And what you're looking for is any blotching, redness, things like that might indicate damage or burning that you're doing to the skin. Okay, so general rule of thumb, if it's an immediately acute injury, like if you see bruising, swelling, a sprain, anything like that, you'd probably want to avoid heat if there's inflammation, anything like that. For those who have diabetes, those who have vascular issues, you want to be very careful with heat just because of that sensitivity and lack of sensation in the skin. It's hard to tell when the heat is doing damage and when it's not. So, cold therapy, yes, we all love ice cold therapy. Different forms of cold therapy. We have ice pack. So you could use a bag of peas, you could use, whatever, gel packs, things like that. You can use coolant spray, so BioFreeze is what we use a lot in treatment, or icy hot, things like that. You can use an ice bath, put a bunch of ice in a bathtub, lay in it. And lastly, you can use kind of ice massage. So you can take a literal piece of ice and you can rub it on the affected area. Or I like to use Dixie cups. You fill a Dixie cup, one of those small cups up with water, freeze it, tear off the top, and you have yourself a nice ice massage. Benefits and when you would use it include reducing muscle spasms, so kind of like the heat as well. You can use it for acute injuries. Ice is generally used for those acute injuries, the sprains, the swelling, the bruising, things like that where you want to dampen down that inflammation. It can be used for pain, especially specifically with nerve pain. So cooling the area or icing is going to reduce the signal that's being sent with nerves specifically. So in regards to time, generally I like to say 20 minutes. If you're using an ice pack, I like to see patients with something in between, whether that's a thin towel. Again, checking it every 10 minutes just to see, look at sensation, blotching, things like that. If you're using ice massage specifically with ice directly on the skin, 10 minutes max. You want to give it a break, and you could do this maybe every hour. All right. For those who have a lack of sensation, so this could be a variety of ailments, comorbidities, generally want to be careful with ice directly on the skin, just because your body can't regulate, how cold it actually is, and potentially can do damage. Okay, so just to recap, heat is generally going to bring blood flow, nutrients to the area. It's going to kind of allow for that pliability in the muscles, allow muscles to relax. Ice used for more acute situations to reduce swelling, inflammation, bruising, pain, nerve pain specifically as well. So those are the general rules of thumb for when to use ice versus heat. There are situations where both would be appropriate. And the general thing with how I treat patients is if it feels better after using either or, that's the way to go. So there's no black and white situation here. Maybe specifically for if there's extreme bruising, acute inflammation, I would go kind of lean on the rule of ice. But I like to just say if it feels good, if it makes you feel better, go in that direction. So for those of you who have used these techniques, I'm sure many of you have used both for different situations. Please let us know in the comment box below. We love to hear from you. What has helped the most? If you have any tips, tricks, anything like that, let us know. Again, subscribe to our channel. We love it. We appreciate you, and we'll just keep putting out good footage. All right.